I'm Dr. Alex Mantegui, Pediatric Ears, Nose, and Throat Specialist here at Barton Health, and this is your Barton Health Peek. We are here today discussing ear infections and ear tube surgery. A middle ear infection is an infection of the middle ear space, which is the space on the other side of the eardrum when you're looking into the ear with an otoscope. It can be bacterial or viral origin, and I often tell parents it's often a side effect of a cold. So basically what happens with the cold is that you have congestion, and that congestion kind of gets to the back of the nose and causes eustachian tube dysfunction. The eustachian tube is something that we all have. It's the thing that equalizes pressure between our nose and our ear. So when you're going up on an airplane and you hear that thing popping, that's your eustachian tube popping. Kids and little children naturally have eustachian tube issues and such that theirs don't work as well as adults do. They're more horizontal in position and they're smaller. And so overall, they're poorly functioning compared to an adult. And so when they get a cold, the eustachian tube gets congested, or these kids develop eustachian tube dysfunction. And when that happens, you get a backup of pressure, which can turn into fluid, which can turn into ear infections. The signs and symptoms of an ear infection are ear pain, tugging at the ear, fevers, poor sleep, poor appetite. And really, when we look at an ear infection, an acute ear infection, we define as simply a red, angry-looking eardrum when we look in the ear, plus a fever. So the cornerstone of treating ear infections is giving antibiotics. As an ENT specialist, children often get referred to us after they've had a certain number of ear infections, or they have persistent fluid in the middle ear space. On average, when kids have had 3 infections in 6 months or 4 infections in 12 months, they often get referred to us for evaluation for ear tube placement. Basically, because of that underlying eustachian tube dysfunction we discussed earlier, that fluid often does not clear. Or it will get infected, we'll treat with antibiotics, but the fluid will persist, not go away, and at that point, kids will get referred to us for evaluation. So we'll look in the ear, we'll see if the fluid is still present or not, and oftentimes we'll get a hearing test. The combination of a lot of ear infections, fluid in the ear, and an associated hearing loss often makes a child a candidate for ear tubes. And at that point, surgery is discussed with the parent. If the child is a candidate for ear tube surgery, they'll go to the operating room and they'll get general anesthesia, generally with a mask. We'll look in the ear canal with an operating microscope, we'll clean the ear canal out, and next we will actually make an incision into the eardrum with a little knife. At this point, all the fluid that was backed up into that middle ear from all those infections, we'll evacuate it, we'll clean it all out with a vacuum and a suction, and then once it's all out, we'll put a little tube in there. And this tube is generally no more than 1 to 2 millimeters in size. And it sits on the eardrum so that it actually ventilates the middle ear. And once the middle ear is ventilated, then the number of ear infections statistically have been shown to go way down. If your child has had lots of ear infections, or they're always tugging at their ears every time they're sick, if you're worried about their hearing and they're maybe not responding to sounds as much as you would hope, or you're worried about their speech, then I would say come see me. We can take a look at their ears, get them a hearing test, and decide the next best steps after that. And for more information, visit www.bartonhealth.org/ENT.